This program is brought to you by Stanford University. Please visit us at stanford.edu.
Actually, starting late is kind of a test, so you were right. There are a lot of fake Type A's here because they weren't popping out of their seats looking at their watch, getting angry, and just one person. I think it's really nice for the Blood Center to offer this kind of Cafe Scientifique, kind of a nice informal approach. It's a way to bring you here, get you familiar with the Blood Center, and certainly it's a very important mission that they, a vital role that they serve in our community, and so thank you for all the work that you do. We only have 2 hours, and these are my notes. So actually, these are handouts, and I will give them to you not right now because I want to do some work on the easel, and in order for that to work effectively, I need to hold on to these for a couple minutes. I also... That's okay. Did you get all that noise there in the mic? Good. I also wanted to say a sincere apology. Some of you may have shown up here in March when the program was first advertised, and I was so looking forward to doing that program. However, my sister was very, very sick, and the doctor told my brother-in-law that the family should gather, and so we did that. And she is still in the hospital, but is due to be released. They did an excellent job of both care, medical care, and caring, and she's due to be released hopefully in the next week or so. So I apologize to you for not being here. I took the red-eye instead. And I was surprised when I landed in Newark how many people are up and about at 5:45 in the morning. So the first thing I want to do, and this is the reason I'm not giving the handouts just yet, is Type A is known around the world. There's not a country in the world that people don't know that term. And while it is well known, it seems to me that there's a lot more misinformation than there is accurate information about this condition. And so what I would like to ask is, could you help me identify what it is that you know, or what you think you know, what you've heard about Type A, what it is. I'm going to make a long list here, and I'm going to leave it there, and then I'm going to go through my presentation, and at the end, we'll come back to this, and we'll see how much of what you had identified was accurate or not. And it also serves as an interesting kind of review at the end. You know, in education, they always teach you, tell them what you're going to say it, and then tell them what you told them. So after 3 times, they get the message. So this is kind of a nice way to summarize at the end, and I'll ask you to help me. So I'll point to one and say, so this one, is that true or not? And then we can, you know, kind of go through it that way. We'll also have time for questions. I love the 2-hour format. Thank you. I've been doing Type A stuff for more than 20 years. And my only regret in all the work that I've done is that I didn't write down all of the stories. I've started to do that because when I give a lecture, something will pop into my mind, and then I go back to my home and I write it down. The stories are amazing, and I love teaching through stories. So I have a lot of stories to share with you. It won't be a real boring kind of lecture. So, what are the things that you've heard, know, or think you know? Yeah. Need to be in control, or things fall apart. All right.
We are more task-oriented.
Okay, task-oriented.
We're drivers who like to get things done. We like to start on time. We don't like that. I could go on.
You don't want to hog the forum, huh? Yeah, I got it. Yes, ma'am.
Yeah, driven to the point of obsession.
Ah.
Uncomfortable doing nothing.
Oh boy, yeah. And the rest of us just call that relaxation, or recreation, or rejuvenation, or sleep, or hobby. Yeah, okay. Another one. Oh, yeah, I noticed here, yeah. No lines, yeah. Okay, hostility. And I should point out that that is the correct word. Oftentimes people say anger. And anger is a human emotion, and it is positive in many ways. All of us get angry. Even the most docile of type Bs get angry. But hostility is a different concept, and it has to do with wanting to hurt, wanting somebody to pay for something that they did. Or who can I blame for starting late? Or who can I blame for that long line? Or who can I blame because it's 74 degrees instead of 72 degrees? So hostility is a much more accurate term than anger. We will spend a lot of time on that. Yeah. Yeah, so urgency without a reason, and I'm reminded that Alabama had a song called I'm in a hurry and I don't know why. And the refrain was I'm in a hurry and I don't know why, and you know, then the story and then the refrain again, yeah. Okay?
Kind of on that same topic, being very impatient with people who are not as fast as you, or wanting to maximize your time.
Uh-huh, yep. So impatient. I'll call what you said efficiency. When you said maximize your time, efficiency. Okay, have a good story about that. A wife said to her husband, I want to get a new car. And he said, I'll be right back. So he went into the office, got on the computer, went on to Kelley Blue Book, did some math with his calculator, came back out and handed her the paper and said, nope, can't do it for 18 months. Really? Why not? Well, I did all the math, and the math says the best time to sell versus buy, the most efficiency, is in 18 months. She laughed, said, you didn't hear me. I said, I want to get a new car. Okay. So, yeah, somebody had a hand here, yes.
Yeah, you're likely to find your teeth clenched.
Ah, yeah, teeth clenched. We have a slide at the Meyer-Friedman Institute of a woman who had a little gap between her two front teeth, a little bit of a gap. And we took a picture of her tongue because her tongue was shaped with the tongue protruding through the gap in the two front teeth. All of her stress was right here in her face. She did not have a friendly face. Okay?
That's no such thing as a type A personality. It's a behavior.
Oh, man. Type A behavior. Now, I have to tell you, that is something I never get. There's such thing, sorry, I said that wrong. What he said was, no such thing as a type A personality. It's type A behavior. I almost never hear that. But you know what? Ian's a ringer. he was in one of the Type A groups for 10 years probably. He met up here at EPRI, and I'm glad he's here because if I don't know the answer to something, I'm going to go to the expert. Okay, a couple more.
To mention something positive that I think is true, they set a lot of goals. They have active goals and they're ambitious.
All right, one more. Oh, yeah, okay. We'll put that one up here. Perfectionism. Okay. That's a pretty darn good list.
I was just curious if the type A behavior, person or whatever, type A personality, if they would appreciate the way you're writing everything up there, or if they would like want to put it in order.
Alphabetize it, you mean? Yeah. Yeah, that's probably true. I had a guy in class and we were talking about type A's who make lists. And the story that I presented was that the wife said to her husband in church one day, "I think it's fine that you make lists, but I don't think you ought to be doing that during your best friend's memorial service." So some of these things created the need for that man during his best friend's service to make a list. So I got a guy raise his hand. He's a mover and shaker in Silicon Valley. He said, "You know how many items are on my list? 1,500. I said, 1,500? Wow. He said, "But I was thinking, I'm going to computerize it. Because I think if I made a list by alphabet, I think I'd get more of them done. What do you think?" I said, "Do you have any pens or pencils with you? Give it to me. It's a dangerous weapon in your hand." His shirt pockets were torn from putting 3x5 cards in that didn't make it to the dresser or wherever he put them. It just stretched the pocket until the stitching wore away. Okay, I'm gonna go ahead and start. Did you have a question? Yeah.
Well, just something that struck me when last we were mentioning about the list of the memorial service. Maybe there's a way too of coping with emotional. Yeah, it's a comfort thing. You know, it's not just control, but it's a way of maybe suppressing the emotions too.
Okay.
Like workaholism.
Okay, I'll talk about that as well.
I just wanted to mention that a younger friend of mine who's a software engineer now told me and showed me a website that's called something like 63 Things or something like that, where people actually write a list of, that many or whatever, things that they want to accomplish in their lives, and then they set goals, and then other people on the list, on the server, the list get to comment on it, and I'm just wondering if I'm on the list.
That's not, I don't think that's what most people were thinking. I'll Yeah. She said that there's a website and you can go onto the website and you can make a list of 60 or 70 things that you want to accomplish and you set long-term goals, and then other people can comment in blog fashion and help you, with those goals. And she said, and so the punchline I said, I don't think you were anticipating was, what a waste of time. Okay, so let me go ahead and begin. First of all, I want to talk a little bit about Dr. Friedman. He is the person who coined the word type A. And what you need to remember about Dr. Friedman is that he was a cardiologist. He had done wonderful research. In fact, he had done research on animals, on bypass grafts, 40 years before they were approved for use in this country. He had the right idea, they just didn't have the technology to support doing bypasses. But he was the first person to do that. One of the radiologists at Stanford who was in one of Dr. Friedman's groups nominated him for a Nobel Prize in Science. And he has been referred to as the father of behavioral medicine, because what he did was to take behavior patterns and apply it to issues, in this specific case, heart disease and the prevention of heart disease, by using principles of behavioral science and psychology. So at one of the annual professional meetings, they referred to him as the father of behavioral medicine. So the first part of the story is he was giving a lecture in San Francisco for the League of Women Voters. And the president of the league there said to him, "You know, Dr. Friedman, you're talking about heart disease. I can tell you what causes heart disease. It's simple, it's stress." And he said, "Well, tell me more." And so she said, "Everybody I know who's had a heart attack lives a really high stress life." And he said, "Well, tell me more." And so she started to describe characteristics of her friends who had had heart attacks. So he kind of tucked that information inside of him. A couple of weeks later, he was having his office furniture reupholstered. And so at the end of the day, the guy comes, knocks on his door and says, "I'm here to collect my money." Dr. Friedman said, "Okay." He said, "What kind of doctor are you anyway?" He said, "Well, I'm a cardiologist." "Why do you ask?" And he said, "You know, I reupholstered your chairs, but I have never in my life seen wear on chairs like in your office." I said, "What do you mean?" He said, "Well, you know, most time chairs are worn right at the seat. People move around and they scurry around in their, kind of scooch around on their seat. And also in the back and the shoulders. And so the shoulders rub. That's where most chairs are worn. Your chairs were hardly touched. The only place they were worn was right on the edge of the seat." He said, "The only thing I could figure out was people are sitting on the edge of their seat waiting to see you. So I wondered, what kind of doctor are you?" Well, now he put those two pieces of information together. Stress, sitting on the edge of your seat, reupholstered chairs. He was in partners with a fellow named Ray Rosenman, and they said, "Let's go through our list of patients and write down some things about how they are in terms of the stress that they manifest." And they created a whole list of characteristics. The next step was the first part of they did 3 very large studies. This was the first part of that. It was done probably 40 years ago. It was to see if they could predict who would have a heart attack in the next 5 years based on those characteristics that they had identified. And in a way that was statistically significant, they were able to do that. They predicted who would have a heart attack. And they did it with accuracy that was equal to knowing if the person had high blood pressure, or knowing if the person had high cholesterol, or knowing if the person was a smoker, or if they were overweight. And as a matter of fact, it was not only equal to any of those individually, it was equal to those in combination. So they thought, we really have something here. The second study, they applied to NIH, and the study was to determine if they could prevent a second heart attack. Now that's real important because the number one risk factor for having a heart attack is having a first heart attack, because you've weakened the heart, and there's a section of the heart that doesn't work anymore. And the lifestyle that got you there is still probably in place. So you add all that up, and people who have one heart attack are much more likely to have a second. So they applied to NIH. They finally got the money. I'll come back to that in a second. It was a 5-year study. At the end of 3.5 years, NIH came to Dr. Friedman and said, "Stop the study." Why? They said, "You know, your data show that you have already succeeded. It's not going to take 5 years. 3.5 years, we know this will work. Take the rest of the money that you have left in your budget and give the intervention to the control group." That's the only time I've ever heard of that. They stopped the study, used the rest of the money to provide the same intervention to the control group. That was a very famous study. But what's interesting, I think, about that study is That's how the name TypeA came to be. Dr. Friedman wrote this proposal, sent it into NIH. Well, what happens when it gets to NIH, they look at the title and they say, okay, this goes to these reviewers. Send it out to these guys, they'll review it, and then they'll stamp, accept, or modify, or reject. So, first round came back, reject, 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 and all the comments said, this guy's a cardiologist, and he wants to study coronary-prone behavior pattern? What's he know about behavior? He's a cardiologist. So they all rejected it. Well, this went back and forth 2-3 times. At one point, the guy at NIH read the proposal and said, Dr. Friedman, you've got something here. He said, it just makes sense what you're talking about. The problem is we keep sending it to psychiatrists and psychologists, and they don't think you know anything about behavioral science. You need to change the name. So Dr. Friedman said, well, what do you think I should call it? He said, God, I don't know. Just call it like Type A, Type B. Okay. So he submitted the same proposal, called it Type A, Type B. But now, in order to know who to send it to, what they had to do was read the proposal. They read it, they sent it to the appropriate people, and it got funded the first round. Got a very high score. That was the study that was stopped after 3.5 years. The third study, the one that Ian was in, we recruited 3,000 men and women from around the Bay Area. He started by going to large companies like Lockheed and EPRI and Apple and Amdahl and Tandem, and recruited large numbers of people. And that's actually how I got to meet Dr. Friedman. I was doing a sabbatical leave at the time at Lockheed, and Dr. Friedman wrote a letter to the president of Lockheed and said, I'd like to do this study, and the president goes, send it to HR. HR guy looked at it and said, send it to Wes. I read it and I said, yeah, let's meet. So we arranged to have 7 meetings in a 300-seat auditorium at Lockheed. And they were full. 300 seats times 7, okay? So, Dr. Friedman had done a couple of these, and I was there listening, and he had a slideshow. On one of the times, there were 2 cars coming down from San Francisco. The slides made it. Dr. Friedman didn't. And so, imagine 300 Type A's in an auditorium, and I'm sitting here looking at my watch, saying, he'll be here any minute. They left at the same time. He probably got a traffic light. He'll be here 10 minutes later. Just a couple more, you know. I'm thinking like revolt is going to take place. So at some point, about 20 after, I said, well, let me just start. So I had seen the slides, and I started. After about 10 minutes, the door opens, Dr. Friedman comes in, and as he's walking down the aisle toward the front, he kind of takes over my sentence. And so I go sit down, and he said, hey, we need to have you in our group, and would you be willing to lead some groups for me? So that's how I got introduced to Type A. It was one of the best things, most fortunate things in my life. I have learned more from doing Type A groups, and this is not a joke. I have learned more from Type A groups and what happens in those groups, the dynamics and the way in which people change, and they do change, than I learned in all of my undergraduate years of education. The study of human nature is fascinating. And you can all be amateur behavioral scientists as you watch your friends, as you watch yourself. It doesn't take very long before you can identify a Type A and be pretty accurate. Okay. Yes, ma'am.
Was the purpose of these Type A support groups to modify the behavior? Is that
Yes.
Okay.
Yeah.
And so I have a question. You said a first heart attack is the best predictor of a second. What is the normal time lapse between the two, and is that period long enough for the intervention to occur?
Yeah, for some people. The time lapse depends on a lot of factors. How significant the first heart attack was, what the causes of that first heart attack were, how old the individual is, and whether they have any comorbidities, meaning they've got other sickness that their body is trying to struggle with. So for some people, the answer is no, the intervention wouldn't matter, it just you couldn't get there that fast. But for enough people, you know, 5 years is plenty of time. They do have 5 years and often beyond that.
Just find out if type person is automatically somebody who does not have these attributes, or can it be that a type B person may have some, I mean, can it be that you're pure type A and kind of type A and sort of type B, or is it just like?
Yeah, that's a great question. Her question is type A yes or no, or is there gradation? And I will talk more about that, but I'll answer your question is it's gradation. The range is from 0 to something like 480 points. And the 480 points is not based on a paper and pencil test. Because if I gave you a test, you might identify some of your type A characteristics, but you would miss a whole bunch. And there are some people who wouldn't identify any. They say, I've had a lot of wives give the type A book to their husband. Husband reads it and says, this was stupid, what's this all about? Well, you didn't recognize yourself in there? No, I'm not like that. So yes, there is a range. And as a matter of fact, at certain places, with certain people, under certain circumstances, it can bring out the type A in you. It is a continuum. However, there is a cut point. The range is 0 to 480. The cut point is 45 points. How did they determine 45? Well, what they did was they went out and got 100 gold standard type A individuals. The person said, I'm type A. Their spouse said, he's type A or she's type A. Their kids said it. Their friends said it. And they had a heart attack. These were gold standard type A's. They plotted their scores. They went out and they tried to find 100 type Bs. Couldn't do it. They found 37. So they found 37 type Bs and they plotted their scores. At 45, 1A was just under the line and 2 Bs were just kind of 1 point or 2 points over the line. So it was the best number to use. So it's 45 points. But it's like DUI or drinking, blood alcohol level. If you have a blood alcohol of 0.05, you still have alcohol in your body. If you have a blood alcohol of 0.10 or 0.15, as you go further out, your intoxication gets worse and worse. As you go further out on the TypeA scale, your type A behavior gets worse and worse. And in the extreme, it doesn't matter whether you're by yourself or with a group of people you don't like, a group of people you do like. If you're celebrating a party or if you're in traffic, you're just angry and hostile and time urgent and maximizing efficiency. It doesn't matter. So I hope that answered your question. Okay. So the third study, I should just say this. It's kind of an interesting, for those of you, I know we may have some Stanford people in here who are involved with science. As you know, you need to do a power calculation in order to make sure that you can get statistical significance. And so they took a look at the Bay Area data for heart attacks. If you have, 3,000 people, how many can we expect to have a heart attack? If you have 3,000 people, how many of them can we expect to die? And so I actually said that incorrectly. They said, here it is for 10,000 people. How many people do we need in order to get enough people to get this power? So they determined 3,000 people. You had to be 45 or older to get in. They did an oversampling of males because males, first of all, have heart attacks at a younger age, and secondly, more males were higher on the hostility score. So they did the power calculations, got 3,000 people in. Half of them were randomly assigned to control, meaning they got a little flyer or something once a year. And half of them met for 8 weeks on the first year, and then 8 weeks in a row, and then every other week after that, and then every other week for the next 5 years. And this was a 10-year study. 3,000 people, you had to carry it out 10 years. At the end, the study showed that there was a statistically significant difference in diabetes. The trend, the difference in heart attack and deaths from heart attack was pretty big between the two groups. But the problem was it was underpowered. And what I mean by that is, as you took a look at the intervention group and the control group, over time, the number of incidents went like this. So that at one point in about 4.5 years, it was a 37%, I think it was 37% differential between the two groups. At about that time, statins became popular. Statins are used for high cholesterol. And so a lot of people in the control group, as well as in the intervention group, you can't deny people from getting unusual care, got statins. They ended up having half the number of heart attacks and half the number of deaths that they had projected because of statins. So that's a very good thing. Except if you're a scientist, you're going, we should have put more people in the study, but you had no way of knowing that. Okay. Yeah, so the next thing I was going to cover actually was the answer to that question here about scoring and the type A and type B. It is a range, but again, as you go further out, you get higher and higher. Here's the other thing. I define type A disease as a type A behavior pattern as a chronic progressive disease. What I mean by that is it is chronic. It's going to be with you for life unless you do something. It is going to get worse over time unless you do something. If you know a type A who's in his or her 20s now, if you run into them when they're in their 30s, you will see a marked difference. And if they're still alive in their 40s, you will see a marked difference again. Each decade, you will notice a tremendous difference in the way that they are. And keep this in mind, we become what we practice. And if you are a type A and you live type A life, you get better and better at being type A. It is a disease, there is no question. Remember what I said, predicting a heart attack by type A was equal to smoking and cholesterol and high blood pressure and being overweight in multiple combinations. So I want to give you some of the, I said that when Dr. Friedman scored this, he did not do a paper and pencil test. So if you were going to get scored for type A, how would we do that? Well, we do it by using a structured interview. And it took a little bit of finessing over a long period of time, but points are assigned to different kinds of observations. So what they would do is they would invite you up, they'd sit you down in a chair, there'd be a videotape here, and there'd be somebody sitting here asking you questions. It was a friendly woman named Nancy, and she'd ask you these questions, and you would respond. Now in the beginning, because you kind of know what type A is, you're on guard. But you know, type A doesn't let you stay that way. Pretty soon, who you really are becomes evident. And there are points that are assigned to each kind of observation. So I'll ask you a question. Which of these two responses do you think would get a type A couple of points? Mr. Jones, if you tell somebody that you'll meet him at 1 o'clock for a meeting, will you be there on time? Yeah. Mr. Jones, if you tell somebody to be at a meeting at 1 o'clock, will you be there on time? Yes! If I tell somebody I'm going to be there on time, by God, I'll be there, and if they're not, the next time I'll make them wait. It's not the point. I mean, it's not the answer. You can be there on time. That's perfectly fine. It's how you say the answer. Okay? A very simple test in cardiology is called the cold pressor test. They bring a patient in and they think they might be at risk for heart attack. So they say, we have this umbrella stand and it's filled with water. We'd like you to roll up your sleeve and put your arm in the water. So a type B comes in, rolls up the sleeve, puts the arm in the water, and goes, wow, that's really cold. You didn't tell me that. That's freezing. Can I take it out now? The type A comes, roll up your sleeve, okay. Whoa, what in the hell are you trying to do? Kill me? Which one do you think the doctor is going to predict is going to have a heart attack? It's not rocket science here, okay? All right, so some signs and symptoms that they look for. One was, and you're going to get these, and you're going to get lots of other things, but one was a hostile face. You know, if you look at a pit bull in a junkyard and you go up to that gate, you're going to know that pit bull means business. You're not going to go anywhere near. There are people just like that. A hostile face tells you it's a hostile person. I had a wonderful pediatrician in one of the groups, and he had the kindest, nice, he had the perfect face for being a pediatrician. And he got to be type A because all type A is rooted in insecurity. Factually, he had no reason to be insecure. He's a wonderful man, brilliant, nice guy, successful by any measure. But he didn't know that. Okay? So when you look at somebody and they have a hostile face, yeah, there's some points that go down on the TypeA scale. When you grimace a lot, and a grimace is like this. Not very pleasant to look at. If you go to the weight room over at Arriaga at Stanford or your YMCA, wherever you lift weights or whatever, and you see somebody lifting something heavy, struggling, it's the same thing. This is shorthand for the big grimace. And a good example is, Dr. Friedman made this observation, Dick Cheney. You would think that he's a type B because he speaks slowly, he speaks deliberately, he speaks softly. But he has this grimace, and what drew it to Dr. Friedman's attention was he had a heart attack fairly young, and Dr. Friedman wondered why if he's a type B. And then he watched some of the videotapes from CNN, and he could pick out some characteristics of type A. Another one is a hostile, jarring laugh. Laughter is meant to be a relief. It's supposed to feel good, like a sneeze. But here's the way type A's laugh. Somebody tells a funny joke and they go, "Huh." That's their laugh. That's about as humorous, that's about as let go as they can be. Fist clenching. So if I'm going to tell you a story, why would I do this? But type A's do that because it's, again, symbolic of struggle, like lifting that weight and grimacing the face. Watch and see. And the real bad ones do both hands at the same time. They're ambidextrous type A's. Irritating, grating speech. Type A's want to make sure that you know how impassioned they are, and it changes their speech pattern. We have a wonderful audio tape of a driver, and he lives in Piedmont, but he works in San Francisco as a corporate attorney. And he's telling Dr. Friedman, he says, "Let me tell you how I drive." Dr. Friedman said, "That'd be great, I'd love to hear it. When I drive down the street, when I'm in San Francisco and all those traffic lights and the Muni buses, when I'm on, let me tell you something, Dr. Friedman. Well, you asked this question, so I'm going to tell you about this right now. When my driver is in the wrong lane and I see that there's a truck up there making a left and he's in the left lane and I know he should be in the right lane, well, then we get to where I'm going and I say, 'You stupid idiot, you should have been in the right lane.' And then he says, 'Lots of times I'm not even going anywhere. Lots of times I'm not on any heavy schedule, but it's just this pattern. I gotta be there. I gotta beat the other guy in that lane. I gotta get there fast.'" He had a really irritating, grating speech pattern, kind of like that. Imagine being married to me if I talked that way, okay? So it was kind of funny because the guy was a fresh choice, a guy in one of my groups, and he was sliding the tray down, and the guy behind him was talking, and he started laughing. He turned around, he said, "So that's the guy." He said it to himself. The speech was so noticeable that this guy was behind him in a fresh choice from a tape that he had heard months before, and he picked him out. But you know people who struggle when they speak. They want to say everything at once. It has to be said efficiently, but it is not done that way. They get frustrated. And they emphasize word after word after word because they want you to know how darn important this thing is. It's dysrhythmic, and it's shouting when it doesn't need to be. Another one is the use of obscenities because that accentuates, I really mean business. I really, really, really mean business. A tick in the eyes. A tick in the eyes means a flaring. And what happens is you start to see the whites of the eye, above the colored part of the eye. William Buckley was a great example of this. He had a program on TV appropriately called On the Firing Line. And you know, he was razor sharp, and he would get those jabs, you know, and he would just love it when he did. But you could see the hostility in the flickering of the eyes.
You know what's interesting about that is seeing the whites of the eye is a sign of anger, but it's also a sign of fear. And everything you're describing sounds like the person's in battle with the world. It's very competitive, and it's almost their survival. They've made it into a survival issue where it doesn't need to be.
Yeah, absolutely. Battle with the world is a great character, a great description of Type A. Yeah. I'm not going to go through all of these, but you're going to have all of them on your handout. Competition. Everything is competition. A Type A can't even let their 10-year-old win in checkers. And then the rationalization is, well, it's a tough world out there, and kids have to learn to lose. Well, when are you going to learn to lose? Or even intentionally. But they can't do it. They can't bring themselves to lose at anything. I had a guy, he was talking about driving, and there was 2 lanes. You know, kind of like Alpine used to be 2 lanes, and it would go into one, and you kind of had to go. There's kind of a courtesy, left lane, right lane, left lane, right lane. How hard can it be? Except, you know, every once in a while you get somebody who sneaks in. And this guy was in the right lane, and this guy was going to sneak in, and he said, I was practicing all my Type A stuff, and all of a sudden my right foot took leave of its senses. I couldn't let that guy get ahead of me. Fixed, angrily defended positions. We could have a party here, and we could all be talking, we could be debating. And Ian and I are debating, and these guys are on the other side of the argument. The Type A will come in and immediately come to us, because there's energy here. And Ian and I will be losing, so he'll come and join our side. And then when we start winning, because he joined us, he'll go and argue the other point. It's not in the issue, it's in the argument. They love the battle. And I always tell people, don't argue with a Type A. It's a home game for them. They have much more experience. You're going to lose every time. Time urgency, on the other hand, facial tension. They are always scanning. They are looking. They are waiting. They are looking at their watch. They feel like kind of a drop of water on a hot griddle. They are always have to be moving. And somebody mentioned earlier, I put the word motorizing. Type A's motorize away their anxiety. They just can't sit still. They'll tap their foot. They'll jiggle their knees. They'll move their fingers. They just have to be moving. There is somehow release when the muscles are expending energy. It's a way of getting rid of all that stuff inside. Hurry the speech of other people. I could be having a nice conversation with one of my best friends. Well, you can think a lot faster than anybody can talk. You know, and in conversation, you know where the guy's going, but Type A's will actually finish the sentence for him. Because it's a waste of time. I know what you're going to say. Let's get on with it. And besides, it's my turn. When they breathe and talk, they don't do it like I'm doing it. You don't know when I'm really breathing. Type A's will talk and talk and talk and talk and talk and talk and talk. Why do they do that? They do that because as long as they're in talking, they're in control. They've got the floor. They're spouting off. And what if they say something that somebody else disagrees with? It's only going to be known if I stop talking and you give them a chance to talk. So I keep talking all the time. Difficulty doing nothing. The idea of recreating or getting off of the freeway to get gas in your car because you might run out of gas before you... The Type A will stretch it. You know, I've got an appointment, I got to get there. And so they eat fast, walk fast, talk fast, think fast, do multiple things at the same time. If you look at their desk, they got a pile here, pile here. They start this, get something, and then they get an idea, set that down, and come over to this pile. It is, in fact, very inefficient as a way of working. They also don't take vacations and they don't have hobbies. It's a waste of time. I could be working. One of the physicians in Menlo Park uses the term, that kind of person is a human doing, not a human being. And he told a little story that kind of went with that. 3 monks were in a cave. The first monk said, I heard something out there. 2 weeks later, the second monk said, no, you didn't. 2 weeks later, the third monk said, if you guys don't quit arguing, I'm going to leave. Now, they were human beings. So one of our group leaders was a Jesuit priest, and he was the head of the Student Health Center at Harvard. And hearing that story, he went to a cloister in France, and he was there a while, and he said to the head person, when's the last time you had a heart attack here? And the guy said, oh, I don't really know. I'll go look it up. So he comes back and he said, oh, it was in 87. He's 87. Wow, could I talk to that person? The guy goes, what? 1777, or whatever it was. In other words, they hadn't had a heart attack in over 100 years. Okay? And for those of you that think that hostility is the worst of the two, it might be, but it's a complex. It's all of it. There's a guy at Duke University named Redford Williams, and I recommend this book. It's called Anger Kills. And he's done a lot of research, and what his belief from his research is that it's anger and hostility and not time urgency. Not time urgency, not efficiency. And he and Dr. Friedman were great friends, and Dr. Friedman said, well, Red, I've done a lot of work out at San Quentin. Wouldn't you agree San Quentin's a pretty angry, hostile place? Yeah. You know, they don't have a lot of heart attacks out there. Really? Why not? Time means nothing when you're a prisoner. You're going to get up the same time every day and somebody's going to get you up. You're going to go to breakfast, you're going to go to lunch, you're going to get exercise. Your day is scheduled. You don't have to worry about a thing. Okay? So hostility is kind of an important measure, but time urgency is equally important. The reason they didn't have heart attacks, they had no time urgency in an environment of lots of hostility. Okay, I'm going to leave those. There are many more that you'll read on that sheet.
That's just another facial sign. The smile isn't the smile. The eyes are not smiling, the mouth is smiling.
Yeah, what Ian was talking about was a facial sign as when the person smiles, but you know that there's nothing there. The rest of the face and the eyes are telling you, I'm not really smiling. And as a matter of fact, one of the drills that we ask people to do in our program, you probably remember, is whenever you pass a mirror or a window, look into it and smile. Look at yourself smiling. And smile until it feels good, until it feels warm, until it feels like it comes from here. Because there is something between the body and the brain. And when you are smiling, that conveys a message. Those muscles are saying to your brain, I'm smiling. There's no dinosaurs here. I'm safe. This is good. And your brain appropriately then doesn't send any bad hormones throughout the body. So smiling is a good thing. Watch for people. Become amateur sleuths about type A. Watch for people who talk fast, eat fast, walk fast, smile with hollow kind of facial expression. Okay.
I just want to know if any, I'm assuming that you will be giving us tools on how to modify behavior type balance. I was wondering if studies have been done on, type A behavior type people and, conventional success. And usually it's a type A people who are extremely successful. So I think what I'm trying to find out is it possible to be type B and successful?
Beautiful. That's a wonderful question, and it's a great question for everybody to know the answer to. The belief is that if you're type A, in fact, somebody put it this way, it's a good thing that there are type A's in the world or we'd still be in the Bronze Age. That's the way they said it. But we did a study where we asked people in the Type A groups who had been in for a while and who had lost a lot of points, who had become Type B. In your life now, is your career more or less successful? There was not one person who said less successful. That was one. The second, than they had been previously, than for themselves, comparing themselves. In another study, one of the people on the Institute's board was vice president at Charles Schwab. And he was an interesting guy because his reputation at Schwab, before he joined the Type A group, was on the executive floor, you could hear him when you got off the elevator, meaning he was yelling. And he liked that. He thought that was a good image to project as a vice president. If you can hear me before you can see me, I'm being effective. So because of him, though, we got access. Schwab has performance reviews, and performance reviews are numeric. We have a Type A scoring list that's numeric. We could compare. What we found was two interesting findings. In general, there was no correlation. There were two exceptions. For what they used to call in that day secretaries, for secretaries or administrative assistants, if you were time urgent but not hostile, you got great performance reviews. You were doing your boss's work. What else can I do? Okay. For the people who actually answered the phone and took the orders, if they were time urgent or hostile, there was a very high correlation. Imagine you're calling Charles Schwab on the phone and you're getting somebody who's, yep, okay, yep, oh, yep. And you can sense this frustration in their voice. Are you going to call back? If their boss is listening, they're not going to like that, so they score them down. But in general, there was no correlation between the two. We have tapes of generals in the military, of physicians who were researchers. DeBakey, the first guy, to do maybe one of the first, maybe the second, to do the heart transplant. Business tycoons, CEOs of multi-billion-dollar companies. Type Bs in those positions are disproportionate. Disproportionate. There are so few Type Bs that, yeah, there are Type As who are there. Here's the flaw. The flaw is if you're a Type A and you get to be a general or a CEO or a top-name doctor, you may attribute that to being Type A, when in fact, it could be that you would have gotten there sooner or certainly easier, less struggle, if you would have applied the same knowledge, the same skill, the same diligence and discipline to your work as a Type B. So Type Bs, first of all, love being Type Bs. They would never want to be a Type A. And secondly, they have the same intellect and skill and discipline as the Type A's, so they can get there. So if you're thinking, it might be a risk to me, I'm a successful person and I'm an A. If I give this up, will I have to make less money? Will I have to be less successful? The answer, I can tell you from hundreds and hundreds of interviews and surveys, is no. You can be just as or more successful, but with less struggle. We have a letter that was written by a general, a high-ranking general, to a guy who, I don't know what the level is, but the first level general. And the letter is something like this. You just got promoted to general, and I voted for you. I like you a lot, but I almost didn't vote for you. And here's my advice. You take 2 weeks off beginning right now before you accept this position, and you go away with your family and have a vacation. And what I want you to think about is the way in which you command. You are so over the top with everything, and it looks to me when you're a colonel like you can't even handle that responsibility. How are you going to be as a general? You don't have any more energy to give. I thought that was a wise letter. And the guy did take the vacation. It was so well written. Okay, I'm going to move through a little bit. Type A's are binary thinkers, right, wrong. wrong, good, bad, black, white, good job, terrible job, perfect, imperfect. So we know that one now. Yes?
One thing that's striking me as you're describing this is that there seems to be an awareness on the impact of
Yeah.
their actions on other people.
Absolutely.
And so in the course of changing the behavior, did you assess how, as they went through
Yep.
the support group, people close to them, whether it's intimate partners or co-workers, whether they observed a difference and if they received that feedback? That could be
Yeah.
very...
That was equally important data as the cholesterol, blood pressure, smoking pattern, weight, all of those other markers. The realization of change, self-realization, and it was validated by surveys to spouse, children, if the children lived at home, co-workers. We had one guy at Lockheed, during one of the meetings, he said, I got invited to lunch today by the guys. And I thought, okay. So he said, that's the first time it's ever happened. And I said, well, how long have you been here? 25 years. In 25 years, he had never been invited to go to lunch. I said, well, did you ask them why after 25 years? He said, yeah. They said they like me now. Yeah, you have a question.
Just following on that, the TypeAs, as they go through this program, recognize more or be more sensitive to the impact that they have.
Yes. Yes. And in fact, the question she asked was, do type A's, as they modify their behavior, do they learn to recognize the impact they've had on others? And the answer is, this program has saved countless marriages. In many cases, spouses say, one spouse will say to the other, you need to go take this program or I'm not going to live with you anymore. We're not going to be together. But the self-realization leads to something at a certain place in time. It leads to almost a depression. It'd probably be defined as clinical depression. Because what they're realizing is, I have hurt my family in many, many ways. And often it's the spouse and the kids. One guy, I could tell you story after story about this, but one guy's son went to Boston College. And you know the way college kids are. And so they were out drinking, and he got arrested for being drunk in public. He told the guard said, I want you to call your parents. And he said, I'll stay in jail as long as it takes. I'm never calling my dad. Don't call him, no way. Well, eventually they cajoled and finally convinced him. Well, this guy had been in the TypeA program for a while. His son called and said, Dad, I'm calling from jail. For the first time in his life, the son heard silence. And then Jim said yes. And he said, you know, what he had been arrested for. And he said, could you come? And he said, I'll be on the next plane. When he got to the jail and they released him, Jim said to his son, we'll work this through. I want you to know I love you. That wouldn't have happened. His son calls the TypeA program the miracle program. It gave them back each other. Another great story. Oh, I got 3 minutes. You can, 2 minutes now, okay. He's going to change the tape, it'll only take a minute. This is one of my favorite stories. Guy had no relationship with his two boys. He didn't know their birth dates. He didn't know how old they were. He lived at home, but he was busy working. And his rationalization was, I'm working for them. I'm putting these long, hard hours in for them. And they're saying, gosh, Dad, we'd really rather just have you home. It's nice to see what you look like. So, another story about arrest. His son went to Chico, got drunk. They were downtown. They were rattling some doors in the business section. Police came and arrested him. And so the dad, again, went up there and was very nice to the police and just very gracious as you could be under the circumstance. So the son started to get a glimmer of a kind of a nice guy for a dad. Well, what happened was that Christmas, Tom bought his son some hiking boots because his son loved to hike. And they were like his favorite gift. And it was special because it was the first gift his dad had ever given to him. And so he comes back from one of the vacations at Chico, and the hiking boots are left in the laundry room, and they're filled with white splattered paint all over them. So Tom comes in, and he sees these boots that he gave his son, and he starts to, all the TypeA stuff starts coming up, and he looks at his wife, and she said, "Don't involve me, I'm out of here." She leaves. Well, his son's upstairs. He's pacing, he's pacing, he's pacing. Finally, his son comes down. And the son says, "So, Dad?" He said, "Well, my son has never started a sentence with 'so, Dad.'" Remember, the dad was so nice to him when he went to bail him out of jail. "So, Dad, I met this girl. She's beautiful. I love her so much. I really want you and Mom to meet her. Could we do that soon? I really love this woman." And then he said, "Oh, and Dad, I don't know if you saw the boots on the way in." He said, "Gosh, those were my favorite gifts." He said, I am so sorry." He said, "I'll tell you what happened. We were at a party at the frat house, and we were dancing, and we were holding each other close, and I love her so much, and we just needed to be somewhere alone." The mom comes back from wherever she was. She expected to see blood splattered all over the wall. And here are these two guys laughing and having sodas with each other and talking like they should have been doing all their life. Yeah, they get very aware, and they want to recoup the lost relationships. One of the tapes that we have is an interview between Dr. Friedman and 3 widows. Oh, my 2 minutes up yet? Oh, you're ready. Okay, he switched. Okay. So, 3 tapes, they're called the widow tapes. 3 men who died prematurely of a heart attack who were type A's. Dr. Friedman's interviewing them. All 3 wives sound battered. I mean, the way they answer, it's like they've been abused. Just like physically, but they weren't. It was the verbal abuse. All 3 wives said that they said to their husband, "Where did the real you go?" 3 different women said to their husbands, "Where did the real you go? When I married you, you were this, and over time you became this." And each of the wives said, "I told my husband I couldn't live with him. I just couldn't do this anymore." This is the part that got the people in the class. Then Dr. Friedman would say, simple question, right? "Did you love your husband?" Easy, should be like, "Yeah, right, yeah." Silence. And maybe after a 40-second silence, "Well, yeah." "Well, what did you love about him? He was this, as you described it. What did you love about him?" "Well, the security." "Oh, you're a guy in a class, and you're working 16 hours a day, and you think you're doing it for them, and you hear the wife say, 'I only loved him because of the security.' It's like the bottom falls out." Okay? Couple of more fun points. Insecurity drives all type A's. Insecurity caused usually early in life, but not always. Sometimes it happens later on. But we would ask this question of our type A people. How many of you received unconditional love from both parents? And so hands would go up, and I said, "Oh, wait a minute, let me clarify. I'm not saying did your parents love you. I'm talking about unconditional love." "What do you mean by that?" "Well, you know how your dog loves you? It doesn't matter if you're late, you feed them, you don't feed them. They love you no matter what." How many of you had parents like that? Almost no hands go up. We have a tape called the Carlisle tape. The guy's name is Carlisle. Dr. Friedman's interviewing him. The guy is bombastic. For 30 minutes, he's talking about stupid idiots in his group, and you can see it in their eyes. They're ignorant. And he just goes on and on and on. It's like, turn this tape off, get me out of here. Then Dr. Friedman says to him, Carlisle, did you get unconditional love from both parents? Silence. The next thing you hear is this. Oh, no. My father was incapable of love. And my mother, she did her best, but she didn't have a lot to give. And then he goes on and he says, you know, I knew I would never make my father's team when I made All-American in basketball. And I called my father and I said, Dad, I made All-American. And he said, well, that's fine, but your brother's a better basketball player than you are. Insecurity. Another example. Guy said, when I played that tape and we did that little exercise, guy said, for the first 12 years of my life, I thought my name was My Boy Johnny. He said, yeah. I'd come home from school and I'd say, here, Mom, here's my report card. My boy Johnny. Mom, I made the Little League team. My boy Johnny. Mom, the teacher said this about me. My boy Johnny. So one day he came home and he gave his mom the report card and it had like a C on it. And she said, John! All of a sudden, this doesn't feel good. I like you when you love me a whole lot more. It set him off on a life path of do, succeed, succeed, succeed. And if you do that, you'll always hear your mom say, my boy Johnny. That's a metaphor. It's a real story, but it's a metaphor for a lot of people. I had a guy named Maury. Maury's parents immigrated to this country with no money. They worked hard, worked really hard. They did pretty good. Maury worked at a company, and when I met him, he was like 63. And so he had this way about him of work, and efficiency, all of this kind of stuff here. And I said, how did you get this way, Maury? And he said, well, my parents told me when I was young, I remember I was 5 years old, my mom and dad sat me down and said, Maury, the most important thing you can do is work hard and get a good education and support your family. And that's what I've done. I said, are your parents still alive? Oh no, they've been dead for 20 years. And you're still doing this? Yeah. And Maury, you've worked at this company how many years? Oh, 30 years. And your kids are grown and they have graduate degrees? Yeah. And your house is paid for? Yeah. And you're eligible for retirement how many years ago? 7. Because he had worked at the company so many years. Maury, remember what they told you. Why are you still doing that now? What you need to do, what he needed to do was to take an adult look at something that happened to him as a kid and say, does this still work? Is this still operational? Do I still need to satisfy? I've done what 40 years ago I did what my parents asked. I worked hard, I got a good education, I supported my family. Now it's my time. So insecurity, the insecurity that he would fail his parents.
I have a question. Do you think we can get the air conditioning off?
John, can you get the air conditioning down a little bit?
It may be
Unfortunately,
I'm afraid to let my TypeA show, but I'm afraid.
Sorry, I don't know if this would help, but would you like me to get you a nice hot cocoa
Alcoholics
to warm you
drinking?
up? I'll do that. I'm
cover
happy
that.
to.
Yeah. The question that's being asked is whether there's been any studies that would correlate alcohol or drug use and type A behavior. And as far as I know, as far as I'm aware of, no. But what you have to understand is that people who are perfectionistic, people who are driven, people who are fearful of the loss of succeeding are people who may turn to other sources to give them energy, to give them strength, to give them courage, false sense of security, and somebody else asked one time if there was a study ever done on hyperactivity as a kid and type A. And at that time, Dr. Friedman was still alive, and I asked him, and he said, no, there hasn't been a study. He said, but that should be something that should be studied, because there are a lot of similarities between hyperactive kids and adults who are type A. Yeah.
I think
Yeah, pressure or stress by itself, irrespective of type A, does lead, because it's chronic, it leads to depression. And what happens is people feel so much struggle in their life that they get depressed. As a matter of fact, you're not going to believe this, but I'm going to tell it to you anyway. There have been people who have been wheeled into the emergency room having had a heart attack. And when they get there and the nurse or the doctor greet them, they say, I'm so glad it happened. Now imagine being in an emergency room, doctor or nurse, and hearing somebody say, I'm glad it happened. Really? Yeah, now I can finally let go. I can finally let go. That's not exactly depression, but it points out that when you are living your life under that much struggle, you have to, at times, you have to get depressed. Everything seems overbearing. The world, your friend next to you said, you're battling the world. That's a tough battle. Okay. Way in the back.
Is there also a correlation with type A people being more lonely because of the personality, and is that a correlation to depression as well?
Yeah, they are lonely. They would not describe themselves that way because they think they're the life of the party. They think people love being with them. They think that being loud and rude is bringing excitement to the party. And oftentimes, people one by one start drifting away. And even family, unfortunately, starts to drift away. So yeah, they are lonely people. And they'll find lots of rationalizations as to why that happened. And it might be something like, people, you can't trust them anyway. I don't care if I have any friends. You know, they deserve the friends they get. They weren't a good friend anyway. So yeah, loneliness, depression, sadness, struggle, overbearing.
On average, how long does this one of these programs take to begin to get
Okay,
results?
how long does it take for the program to begin to get results? I always say that type A is a worthy opponent because you have had a system of positive reinforcements for your type A for many, many, many years. It is core. If you started as a type A as a child, it is going to take you a long time. Beginning in about year 2, you start to see some awareness where it's not intellectual awareness, it's, I believe this stuff. And I start to feel better. We give them, somebody asked, I'm going to talk more about how we modify behavior. One thing is drills. As they start to do those drills, they start to feel, gosh, this feels good, I like this. So about 2 years, some people 3, some people 4, some people 5, some people maybe never. Some people will drop out long before they ever get to the critical point. But for those who can make it 2 years, they will say, this has been a positive experience on my life. And Ian said, this program saved my life. I hear that a lot. Yeah?
It saved my life and my marriage, my relationship with my daughter. One good thing about the move from type A to type B is you get a lot of positive reinforcement. You really feel good by the reaction of people near you to this progression.
Yeah.
They want you to get that way.
Yeah.
And the other thing is you never really need to get off your guard. There's always lurking the tendency to have a type A reaction.
Yeah, early on in the groups, somebody, this happens in every group, what would happen is somebody would start making some progress, and then they would have an episode on the way to work. An episode meaning road rage. And they weren't like sad or disappointed or sorry, they did it intentionally. And what they were saying was, I just wanted to make sure I still had it in me. You know, you're changing me. I don't know what if I really need it someday? It's not a one-way route. If you're type A and you go to B, if you want, you can always go back. But funny thing, people don't choose to do that.
I've had some I worked in some very stressful careers, healthcare, life tech, marketing, etc. My experience, and I know there's been some statistics and maybe some studies done, are that, the average manager is probably type A, and people like me who are happy not being a manager but doing the work rather than managing people
I-
It doesn't make you more productive.
Yeah, our question is, do you think we'll ever turn the tide where people will believe that you can be type B and be successful? I think that's begun to happen. I mean, just as you look at people, as you go through life and you look at people and you see those who succeed, and I would encourage you, observe people who are successful and look to see the characteristics. They got there for a reason usually. And what you will see is that type B people type A's tend to go through the early part of the ranks quick. And then they're stalled almost forever. They're never going to get that next promotion because it's important that they not be that way. Type B's will be team players. They won't stand out. But over the long haul, they are recognized and they gradually will pass this person here who was the type A and go to the top. Yeah.
Well, I'm not saying that I have type A, characteristics, and I'm sure I do. I know it. But what I'm really saying is this multitasking thing. One of the things I used to say to people in high tech was, the cliche that I can only do one thing at a time. I used to say to people, well, I can only do two things at a time. Because you were expected to do 3 or 4 things at a time. And it's impossible. You really can't do 2 things at a time.
Not well. You can do them, but you can't do them well.
Well, exactly. So really that's more what I'm concerned about. Not that management, is going to change or that, type of people are going to get promoted.
Yeah. I've heard the term from several people in Silicon Valley when they're interviewing for an executive position. They say, does he have the engine to burn? So what they do, they make a machine out of a human being. They make a metaphor. Does he have the engine to burn? Meaning, does he have inside this kind of drive? Another thing I've heard is burn them and turn them. Meaning use them and then get them out the door. Okay? I wouldn't work for a company like that personally.
When I interviewed Apple 8 years ago, and I was going through this long, chain of interviews with all these different people, one of them asked me to tell myself an adjective to describe myself. And one of the things I said was that I was a perfectionist. He wrote it down and he underlined it several times. And I had a feeling that that was meant to be a positive thing there. I said it because it was honest. But absolutely, because as we all know, Steve Jobs is a perfectionist, and everybody in that company, if you're not, you better pretend to be. That's the best quality, the lot of marketing is quality. Perfection is highly valued.
I agree. All right, you were fine. What I'm going to do in the remaining 15 minutes is I want to go through some more concepts, and then I'll come to some more questions, okay? Oh. Yeah, you should take your hand out. Yeah. The book that I would recommend, it's called Treating Type A Behavior in Your Heart. And you can get that online if you go to the big book chains. They're often used. It's out of print, and Dr. Friedman has died. So, and then the other one is Anger Kills by Redford Williams. Even though he doesn't talk much about time urgency, most of the stuff that's up here is in his book. And if you want, you can contact me at Stanford. It's WALLES at Stanford. I've got lots of worksheets and tools that I can send to you electronically. Yeah. So you're welcome. Thank you for asking that. Okay, so a couple more things, and then I'm going to open it up for questions. One of the tapes we used was called It All Goes Back in the Box. And it was one of the most profound tapes that we used in our group. It's a speaker by the name of John Ortberg, who was a minister at Menlo Presbyterian, I believe, for a while. And then he went to Pasadena, and then he went to Chicago, and now he's back. But he's a wonderful speaker. And he talked about, and he didn't know anything about Type A when he did this presentation, but he talked about a young boy who on summer vacations would visit his grandmother and they would play Monopoly. And the grandmother always won. Because what the grandmother knew is if you want to win in Monopoly, you got to build houses, you got to buy houses, and you got to buy hotels. And eventually you'll wear the other guy down. Well, one summer he learned that. And he bought houses and he bought hotels. And as John Ortberg tells the story, the kids said to him, It happened on Marvin Gardens. I said, what do you mean? He said, my grandmother landed on Marvin Gardens and I had a hotel and I took every last dollar from her. So John Ortberg says, you know, it's useful for that young man to know, to remember what his grandmother told him. His grandmother said, now you have one more lesson to learn. It all goes back in the box. All the houses, all the hotels, all the properties, all the money, it all goes back in the box. And the next time that box is opened, somebody else is going to own those houses and hotels. It was metaphor, clearly. But you know, the point is that we work and work and work and work to accumulate, and at some point, it's all going to go back in the box. There is a flaw in a belief system that we have that more eventually will lead to enough. So I'll give you two examples that John Ortberg gave. Howard Hughes, more, 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 more. Did it ever lead to enough for him? Marilyn Monroe, relationships with high-powered people, magazine covers, fame, all the glitz. Do you think one more magazine cover, she would have said, now I crossed the line, now I have enough. People on that path, it's a loser's path, it's never ending. More will not lead to enough. Take some happiness in what you have. Okay, oh yeah, time urgency. Remember I said that for type A's, they like to be on time? Here's a story, this is a true story again. A woman worked in San Mateo, we're doing a group there, and she was a very high type A. She wanted an appointment with her OBGYN that was down in Redwood City. And she had to wait 6 months to get the appointment. So on the day of the appointment, she thinks, okay, it takes me a half hour to get down there, so I better leave. But the phone rings, so she picks it up. So she grabs her coat and she's starting to walk out, and the computer goes ding. She has a message, so got to answer this. And then she picks up her coat and something else and something else. Well, to make a long story short, she's 15 minutes of time in a half hour to get there. I mean, she has 15 minutes to get there, and it takes a half hour to get there. So she speeds, she's going down 280, she's making up a little bit of time, she's still going to be late, but she's still hoping. She comes to the exit at Woodside Road, and there's an accident at the bottom, and the police are there. And they're letting one car at a time, very slowly, go around the accident. There's police, there's ambulance, there's fire trucks. This woman gets to the bottom of the ramp, and they're loading one of the victims from the car accident into the ambulance, and this woman could not help herself, and she said, she rolled down the window and she yelled out the window, "Thanks a lot, you stupid idiot, you made me late for my doctor's appointment." If anybody is going to be late for an appointment, trust me, it's going to be a type A. Because it's one more thing, one more thing, one more thing, and then they're late. Okay? Not all type A's are late, I'm not saying that. But if somebody's late, it's probably going to be a type A. I had another, this was kind of a funny story. I thought I was making progress with this guy. And he's the kind of guy that when he gets a piece of lint on his red Corvette, it's like a big deal. He has to go and, take that, and then he has to take his handkerchief out and wipe off because there might be a fingerprint. Well, he has to cross the San Mateo Bridge to get to his job. And there's a lot of stupid idiots. They run out of gas. That's what he said early on in the group. So I thought he was making progress. He said, I had a realization this weekend. He said, I was thinking, what they ought to do on the San Mateo Bridge is put like rails above, and they could put this little thing that goes down, and then when a car gets a flat tire, they could put something down under the car and they could hoist it up. Yes, sounds pretty good. He says, now his face and his body changes. He says, and then that thing ought to rotate out over the water and drop that. Okay. See, I should have written this stuff down, Yeah, he was serious, yeah. I'm just going to tell one more story and then I'll I'll tell you about the way in which we modify the behavior, and then we'll get to this. Again, one of my favorite stories. Guy was a CEO. He goes to a CEO conference. All CEOs. They made a mistake. The first thing in the agenda was dinner. You got 10 people sitting at a table at a Marriott, 40 tables in the room, and they're all CEOs. You could hear the fork hitting the plate all across the room because nobody was talking. CEOs are like that, you know, they don't want to kind of reveal. So this was the same guy, Tom, I talked about earlier. It's getting uncomfortable for him because nobody's talking. He's looking around going, God. Well, we played a tape the week before. So Tom says, I'll tell you the name of the tape in a second. Tom says at his table, oh, I'm taking a TypeA class. Oh, really? And so so people are asking him questions when they're all eating and he's not able to eat. But he's a smart guy. So he says, you know, last week in class we heard this tape. It's called the toilet paper tape. And it's interesting. Which way do you guys think that the toilet paper ought to roll? Should it go over the top or underneath? And then he sits back. These guys start, goes to the next table, the next table, the next table. You got like 400 executives, CEOs in this Marriott room all talking about whether toilet paper should go over the top or under. One of the things about type A's is they get fixed positions. Remember that argument stuff? They were arguing. In the tape, guy says it should go over the top. Why? Oh, he had answer after answer after answer. When another guy laughs, Dr. Friedman says, well, why are you laughing? He says, well, that's ridiculous. It should go underneath. And he's got an equal number. Pretty soon, guys are, well, I thought you were, you know, I thought you worked at JCPenney. What makes you an expert on toilet paper? And it just goes on and on. How could something that insignificant occupy the brilliant minds of 400 CEOs throughout a dinner?
It's easy, that's why.
Okay, wasn't too easy for them. All right, so what do? The first thing is relaxation activities. Every class began with a relaxation activity. They are so easy, they are so pleasant. It gets you ready for the information. And so it might be just a deep breathing where you put one hand on your diaphragm and one hand on your chest, and what you want to breathe is from the belly. That's the way babies breathe. You watch them on a changing table, their stomach goes up and down. They breathe from the diaphragm. As we get older and we get stressed, we learn to breathe from our chest, and we breathe rapidly and shallow. Gee, sounds like shock, doesn't it? Traumatic shock, breathing rapid and shallow. Or it could be progressive relaxation, tense and relax, tense and relax. Or we used to use biodots. We put a biodot right here. The biodot is a little thermometer. And as you start to relax, you can see that, and the biodot starts changing color, kind of like a mood ring, if you remember those from the 70s. And typically a hand will go up and say, my biodot's broken, it's still black. And so I'll say, what color's yours? And he'll say, oh, mine's turquoise. Why don't you guys switch biodots? His turns turquoise again, and this one turns black again. Okay, so relaxation. All kinds of things do it. Even jogging or bicycling will do it. Physical activity is a wonderful way to break stress. Prayer is a wonderful way to break stress. Most religions, I don't know about most, but many religions have prayers that are repetitive. And you know, there's been this theory recently with kids that when you read poems to them, da-da-da-da-da-da-da, da-da-da-da-da-da, there's something about the rhythm and the cadence and the pace. Isn't there something hypnotic about being on a train? So there are lots of ways in which you can relax, even just thinking, taking a few minutes for yourself and saying, I'm going to think back to a pleasant childhood memory. Or I'm going to put on a piece of music and I'm not going to take notes and I'm not going to read the paper. I'm just going to listen to the music. Lots of ways you can relax. That was one of the things. Another thing was we encourage people to build a monitor, create a monitor. And the monitor is your best friend who has a calming, quiet voice. The monitor does not say, you stupid idiot. It says, oh, you know, okay, you goofed up. Lots of people do that. It's easy to fall back into old habits. Let it go. Will this matter in 5 years? And as a matter of fact, that's an easy thing you can implement tonight, tomorrow. Just ask yourself the question, is this really going to matter in 5 years? And you know most of the times the answer to that question is what? No. Another thing that we encourage people to do are the drills. And the drills are meant to break these things. So we tell people to go to Costco, find the longest line, and stand in it. Now, we don't recommend that they do that forever. I mean, that's not a life sentence. But the thing is, if you can do it one time, then you know you've got it within you to do it if you really need to. And what we encourage people to do when you're standing in line, look at the nice person in front of you or behind you and say, "Hi, I'm Wes. What's your name? Where did you grow up? What are some of the things you like to do?" And the next thing you know, the guy's calling you, "Hey, you're next. Come on, come on." It's like being at a traffic light and you get thinking about something and the guy behind you starts beeping. Time goes by faster, okay? So find a long line and see if you can just stand there and be peaceful. Another thing, another drill is Type A's have fixed positions and they always think they're right. And so the drill on a particular Friday was, say to a group of people, "Maybe I'm wrong about that. Maybe I'm wrong about that." So the guy comes to class the next week and he says, "Friday's drill. Friday's drill." Well, he was a banker and he was a boss, a branch manager. And they used to have staff meetings and they're all sitting around the table. And he had this fixed position and other people are arguing the opposite side, and he remembers the drill. And he says, "Maybe I'm wrong about that." 5 pens hit the table simultaneously. 5 jaws dropped down. He said, "I had no idea I was that kind of person." Another one is to look in the mirror and smile. Okay? Another one is there's 3 P's that Dr. Friedman used to talk about a lot: people, plants, and pets. People, pets, and plants were the 3 P's. You know, there are studies that when people are stressed and they bring a dog or a cat in and they start to stroke it, the blood pressure comes down. So again, it's a form of relaxation. Another thing that we used to build in, this was kind of Carl Thoresen from Stanford contributed this one. Driving is a really bad thing for a lot of people, and it's a metaphor for Type A rationalizations. So what would happen would be that you had to keep track of your driving transgressions, and at a certain point in the curriculum, we'd say, "Okay, time for driving." So, "Ian, what's your driving transgression?" And he'd tell me, and I'd say, "No, we don't count, that's not so bad." And then I'd come over here, "What's your driving transgression?" And he'd say something less than Ian. But I'm the final judge. I'd say, "That's terrible. You lose." So what did he lose? Well, I'd bring 2 dice with me, and I'd give them to him. And I'd say, "Which direction around the table do you want to go?" And he'd say, "I want to go this way." And he'd roll the dice. 1, 2, 3, 4, 5. I had to pay $5 for his transgression. He's sitting there going, no, this is unfair. I'll pay. I'll reimburse you back after class." No, you can't do that. We're in here together. We're a group. I've got to pay. When somebody else has to pay the price, you start noticing, you start being aware of the impact, the effect that you have on other people. We told people the $5, by the way, would go in a treasury, and we could either give it back at the end, or we could all have a dinner, invite spouses, and have a good time. That's what pretty much all the groups chose to do. Let's see here. I'm sorry? Drive in the slow lane. You meet a lot of nice people in the slow lane. You know, I had a guy, he said, when we did this drill, he just said, "I can never do that." He said, "But you know, it really ticks me off when I'm out there on 280 and there's some guy in the fast lane going 70 miles an hour. That really ticks me off." And then he said this, because he's a Type A, he couldn't not say it. He said, "But you know what I like to do sometimes, just for fun? I like to drive out there in the left lane and gradually slow down. 75, 70, 65, 60. I like to look in the rearview mirror at the people. They get really mad." Also, the power of the group. The improvements that people made would not have happened individually. Power in the group. And remember earlier I talked about type A being a worthy opponent? We had a group, there's a cardiovascular group in San Jose. Dr. Green is the head of the group at Good Samaritan. And he got together about 8 heart patients. They had heart attacks early. One of them was like 32 years old and he had a heart attack. And there was a woman in there. She was only 35 when she had a heart attack. So they get them into the program. First night of class, I swear true, we're going around introducing ourselves. One guy says, now they had heart attacks. Remember that part, it's key. One guy says, oh yeah. He said, you know, a couple days after I get out of the thing, he said, the hospital, the ICU, he said, you know, I had to pull somebody over on the road. I had to teach them a lesson. I had to let them know that what they were doing, not using their turn signal, was not responsible driving. So that's pretty bad. Next guy goes around and he says, I used to know these. Anyway, he says something like one-upsmanship. And he says, you know, I challenged the guy to a fight. And I said, well, like, weren't you scared? Meaning about the heart. I said, weren't you scared? He said, I'll have you know, I've never lost a fight in my life. Comes to the third guy, he said, my dad was a Navy SEAL. When I was a boy, I used to love it when my dad would pull people over on the highway. He'd stop them and then he'd reach in the window and he'd pull them out through the window. I loved that. He said, when I got out of the hospital, I wasn't allowed to drive for a couple weeks, but the first day I'm back on the highway, don't you know there's some idiot that I got to pull over. So I'm walking over to the car and he winds down his window and he puts a .38 in my chest. And he said, give me a reason to blow you away, sucker. He said, no problem, I backed away. But I got his license number. I could find him if I needed. Now, these are 3 men that had heart attacks. And on the first night of class, they're trying to one-up each other about how macho they are. Okay, so let's come to this. Perfectionism, type A or not? Absolutely it is, and the slope of the curve gets, you know, you can get 80% of the way there with maybe 20% of the effort. At some point, you need to say, good enough. If you're writing code, maybe that needs to be perfect. Save your perfectionism for that. You'll have more energy. If you're a surgeon, if you're an airline pilot, save your energy for all that stuff. That might require perfectionism. But making cupcakes for your daughter's brownie troop, that doesn't require perfectionism. No control or in control, or things will fall. Things will kind of fail, I guess I should say. What do you think? True? Yeah. Now, one thing I want to say, there are type A control freaks. That's true. But more often, type A's are not control freaks. It is not the need to be in control for the purpose of dominating or being in control. The basis of it is, if this gets out of hand, then what? Now, what do you think their life experience was as a child that led to that? If things, I mean, it's multiple. There's multiple answers. But they had a childhood where at least once something got out of control and it all spun and they couldn't get it back. So many type A's, like they're information freaks. Where are you going? What time are you going to be back? Blah, 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 blah. It's not that they don't trust you maybe or whatever. It's that if I don't know that information, how will I know when to call the police when you don't come home? I don't want things to get out of control. And type A's, they will use a rationalization. They will say, one of the widows said her husband was a principal in a Sacramento school, elementary school, and he loved kids, he loved teaching, but he got promoted out of that to be a principal. And when he first started, every day he would go to every single classroom and greet the kids. It was the joy of his life to go to the classroom and say to the kids, good morning, boys and girls, and they'd say good morning. He loved it. But then he got busy. And pretty soon he wasn't able to do that anymore. Pretty soon the job got bigger than him. And so what he said to his wife is, she said, why can't you give that job to somebody else? He said, I'm a real hands-on kind of guy. Now you see, you take something which says you can't delegate because you're type A, you turn it over and you say, I'm a hands-on kind of guy. Or you might say, I can multitask. All of these rationalizations become a part of the type A pattern. Motorizing, I've already talked about that. Type A's are just fidgety. Not all type A's do that, but many do. They pace, too, is another way that they do it. Task-oriented drivers, absolutely. And I would ask you this question with an implication that there is a difference. Is there a difference between hardworking and hard driving? Hard working means you've got a task and you stay with it until it's done. Hard driving means I got to get there fast, first, best, whatever, because then I'm going to something else that I got to get there first, best, whatever. So being driven is a type A characteristic. Even when you don't have to be somewhere, you're pushing, you're changing lanes on El Camino, you're going through yellow lights to make the next intersection.
I agree about being driven. When you're task-oriented, maybe that's not so much a type A.
Okay, that's very good. He's making a distinction between driven and task-oriented, and I would agree with that. Being task-oriented is a good thing. Most type A's are that way, and pretty much most type B's are that way. That's not the distinction. So you're right. This is not something that is necessarily a characteristic only of type A's. Obsession, I'd say pretty much all type A's have a panoply, a multitude of obsessions. They get obsessed because if they don't manage everything in their head or in their realm, it's all going to get out of control again. There are all sorts of obsessions that they have, like 1,500 things on your to-do list. Uncomfortable doing nothing, it's a waste of time. Why would I have a hobby? Why would I play? Why would I go watch the Giants or the 49ers or the A's or the Raiders? Why would I do that? I could be working. They also have, then they make an ethic that if you're not doing this, you're a lazy bum. Okay. Let's see, this says no lines. We talked about lines. There are people, we have this on interview again. If you go to a restaurant and there's a line, what will you do? Yeah, I'll leave. I'm not going to wait in line. Or what happens if you go to the grocery store and you've got $30 worth of groceries and you get up to the counter and there's a long line? I'll just leave the grocery cart. Let them put it back. They should have more cashiers. Teeth clenching. We carry stress in different places. Some of it's here. Some of it's the tongue against the teeth. One of the symptoms or signs of a type A is when they talk, the tongue is pulling off the dry teeth and it's making a clicking sound. They push so hard against the tongue, against the teeth. Hostility, remember hostility, you want the person to get hurt. Somebody goes by you pretty fast on 280, you say, I hope you get in an accident. I hope there's a cop up there and you get a ticket. Why don't you just say, have at it, fellow traveler. Be nice. So this is a key characteristic. Time urgency leads to hurry sickness, which means you're hurrying even when there's no reason. Time hostility leads to free floating hostility, which means you're hostile when there's no reason to be. You could go to your place of worship and be out of joint because of whatever. Doesn't need to be a reason. Let's see here. Yeah, time urgency and hostility for no reason. You got that. Impatient and goal-driven. I think you'd agree that's probably type A. And the efficiency example. Again, type A's make everything efficient. Even things that have no correlation with efficiency. You shouldn't have to, how many fish did I catch per minute that I was out there? As opposed to a type B. One of my favorite commercials was a beer commercial. 3 guys sitting on a beach with rods in the water, and one guy says, what'll happen if we catch a fish? He says, God, that'll ruin everything. Now, we have, a couple more minutes for some questions. And I know it's about close to 9. If you need to leave, that's perfectly okay. But don't leave without your handouts. In here, by the way, is a Type A rating scale. You can rate yourself. I would do that. If you have any questions, send me an email, and I'm happy to, why don't you pass those that way and pass those that way. I'm happy to answer or respond by email to you. Yes?
So a lot of things that you mentioned, like I couldn't have gone through my grad school without, being time efficient and kind of obsessive. I didn't know how I was going to do it. So what that means is that a lot of people who are very successful using typing behaviors, how do you kind of match putting in a type B personality, but also not being inefficient all the time?
Well,
How do you justify this as a type A person?
yeah, that is what makes it hard for a Type A person to kind of want to become a Type B, because they attribute their success to, let's say, in this case, efficiency. Now, it may have been because you were smart, and it may have been because you studied, and it may have been because you prepared good papers. It may have been for a lot of reasons, and efficiency, in fact, may have been one of the reasons. And I'm not condemning efficiency, that is fine. But when you start doing efficiency in terms of the husband saying to the wife, turn off the dishwasher. Why? You loaded it wrong. It's inefficient. I'm going to reload it for you. I'll show you how to do it. That kind of, it's beyond the bounds of normalcy. And we've had a lot of people say that to their wives. It's beyond the bounds of normalcy. Nothing wrong with being efficient. Nothing wrong with wanting perfectionism in the right circumstance. But most things in life don't require perfection, and many things in life, you shouldn't even be in the realm of efficiency. How do you have an efficient vacation? See 40 cities in 3 days. So you're right, it is constantly reinforced, and that's what makes it hard. Yeah. Say it again? Yeah.
Is that efficient?
Yep. 3 minutes, great. Yeah, we beat the record this time. That's efficient.
So there was a recent study that I looked at that indicated that there was a genetic predisposition to response to stress hormones. So that some people their genetics made it so that they were less responsive, and other people were super sensitive to this. And a lot of what we talked about in predisposition for attacks and stuff like that, but also the vulnerability, have a vulnerability. So the question is any of this type A, type B behavior also genetically?
Yeah. That's a great question. The question is it genetic? Is it nature or nurture? Is it genetic, or is it the, what you learn around you? And I have had lots of people, when that question comes up, said, I had 2 kids. One came out screaming and still hasn't shut up. And one came out and looked around and said, oh, this is going to be interesting. And they're still that way. So what I would say is we do know that you inherit your parents' nervous system, central nervous system. And a lot of Type A is driven by the sympathetic nervous system. The sympathetic nervous system gears you up, gets you ready, gets you charged, because that dinosaur might just be around the corner. So you do inherit your parents' nervous system. So there could be some genetic predisposition, but it only gets activated if what you learn as a child is Type A behaviors, and then it gets continuously reinforced. It's kind of like alcohol. You can have a genetic predisposition, but if you never saw alcohol and you don't drink alcohol, you're not an alcoholic. And the same thing would be true here. If a kid who came out that was high-strung, but somehow lived in an environment with parents who were calm and easy, and they had friends that way and teachers that way, and they felt very secure, it's just not going to manifest itself. Of the two, there's no question that the nurture part, the environment part, is more powerful, plays a bigger role, and a more common role than does genetics. And One thing that I'd encourage, and this was another drill that we would ask people to do, is we put filters on. When somebody doesn't use their turn signal and they pull in front of you, what's the filter? Does the filter say, that guy's a stupid jerk, I gotta get even? Or does the filter say, this is no consequence, I'll just drop back a couple car lengths? Or another drill was first frame. I have to credit Jenna Price, some of you may know Jenna. She called this thing first frame. And I think it's an interesting way of looking at what you're asking. Let's suppose you didn't know Clint Eastwood. And let's suppose you didn't know Dirty Harry, you never saw the movie. And you get to the movie because you're a type A little bit late. So you sit down, and what you see first on the screen is Dirty Harry standing over some guy in San Francisco with a gun in his hand saying, give me a reason to blow you away. Now, you don't know Clint Eastwood. That's your first frame. What are you thinking? You're thinking, that's a bad man. But of course, he was Inspector Callahan, so he was a good guy. He was a San Francisco policeman. A lot of times, what you have to look at is, when you see first frame, you don't know what came before. Don't prejudge. It could be due to a lot of things. If somebody goes from the far left lane to the far right lane and exits, maybe they got a pregnant wife and they're trying to get them to the hospital. You don't know. And because you don't know, at least give them the benefit of the doubt. So nurture is far more important, and type B gets nurtured, type A gets nurtured. I will tell you, type Bs live glorious lives. They have the ability to go to a flower garden and just look and enjoy and feel and experience and be. And if you've never done that, try it, because it'll help you feel good. Okay. One more question. Yes?
Are there some other cross correlations like brainwaves, but what about, it seems like you get a group of type A people all together. I feel like there's must be high testosterone or something going on. There's some other blatant cross correlations that come along and say, well, this is, we now know that this is what I was doing.
You know that there are certain environments you're in with people, and you can feel the environment. It feels comfortable, it feels threatening, it feels calm, it feels energetic. You can feel the molecules in the air pretty much going. If you get a group of type A's all in a room together, there's going to be a lot of energy. The noise level is going to go up, the obscenity level is going to go up, the grimaces and facial expressions of hostility are going to go up. Because it's maybe partly because of testosterone, but it's really more important, it's related to the adrenal glands. Again, the sympathetic nervous system gearing you up. And what we know is that the adrenal glands secrete epinephrine and norepinephrine. And you know what? It feels pretty good when that gets released. It has kind of a little, and that's what they call speed junkies or adrenaline junkies. They get that adrenaline from jumping out of an perfectly safe airplane with a parachute on. So the adrenal glands kind of reinforce the idea that something happens, give it all you got, go all out, get all or nothing kind of concept. So I don't know if I really answered your question about a room full of people. Yeah, I think there's lots of evidence that, and all you have to do is observe. Again, be amateur type A sleuths, go to parties, and just kind of sit off on the side for 15 minutes or whatever and observe. It's interesting what you see about people. Okay?
So how can you calm down type A people?
How do you what?
Calm down, keep the other side.
That's a great question. How do you calm down people? They use the term anger management, and honest to God, I think it's an oxymoron. You can't manage anger. When somebody is yelling and their fist is going and they're using obscenities, I don't know how you talk to them. You don't. Maybe what you say is, look, I can see you're upset. Let me go in the other room and let's talk in a couple of minutes, or let's talk in 5 minutes, something like that. But even that can infuriate them if they're angry. The key is not to get to that place of anger. And what you could do is, and another part of our behavior modification is journaling. What are the things that get you set off? We call them hooks. What are the hooks? you can anticipate many of the hooks in your life. If you can anticipate them, you can plan in advance, what are you going to do when this happens the next time? You may have a coworker who likes to come to your office and stand there and, you know, they're not doing anything, so they just talk and talk and talk, and it bugs the heck out of you. So what are you going to do? You can plan that out. You get irritated at that. Next time that person comes, here's what I'm going to do. And you try them. So did I answer the question? When somebody's angry, it's a lost cause. You just don't argue with them, because that's going to escalate and you're not going to win. If you're not the alpha type A, you're not going to win. Now, in a calm moment, maybe the next morning at breakfast, you know, this happened last night, and I'd like to talk about this. I'd like to say that when this happened, it made me feel this way. And I don't feel very good about that. And not even expect a response or even a conversation, I just want to tell you this.
I would just say that you can't, as we know, you can't change somebody else's behavior, you can only change your own. So it makes me think, and I don't know, I'm a social worker, so I have a little expertise in this. So with a child, you put them in a room and they do a timeout, and they're completely out of control, and then you can do a timeout. But as an adult, you can't put an adult and make them sit in their room for 5 minutes.
Penalty box.
But you can leave,
Thank you
and
for coming.
that situation, so that creates a timeout for them, whether they choose to use it or not. And eventually, if I were with somebody who was so extreme, I would probably leave the person, because I don't want to twist myself into a pretzel trying to remake myself and not set them off.
Yeah, I'm not advising that, though.
Yeah, I'm just giving my opinion.
I think there are, with time and patience and slow, there are ways that you can work. Okay, thank you all very much. You've been really wonderful.
The preceding program is copyrighted by Stanford University. Please visit us at stanford.edu.